Well, good morning, good afternoon, and good evening for some of you. Welcome. My name is Ezequiel García-Elorrio from the Institute for Clinical Effectiveness and Health Policy in Buenos Aires. Greeting you all, and it's a pleasure to join and chair this webinar. This webinar is part of the workshop series called Communicating Science to Facilitate the Uptake of Research Findings into Policy and Practice. This event is brought to you by the Malawi Liverpool Welcome Program, Fiocruz, ICDDRB, and the Applying Research to Policy and Practice for Health program at the Global Health Network. As I mentioned, my name is Ezequiel García-Elorrio. I will chairing this session, and I'm delighted to be joined today by our speaker, Dr. Luisa Massarani, as well as the Global Health Network team that is supporting this workshop. A stakeholder mapping exercise conducted in March 2020 by the Applying Research to Policy and Practice Health program of the Global Health Network highlighted the role of science communication as a crucial driver of research uptake. Different stakeholders within the research uptake cycle, such as researchers, journalists, policymakers, and advocacy organizations, were identified as groups that shape how scientific results are communicated, interpreted, and taken up into policy and practice. In this three-part workshop series, we are working in partnership with inspiring experts to present Communicating Science to Facilitate the Uptake of Research Findings into Policy and Practice workshop, where speakers will share their skills and experience in communicating scientific information. So this workshop has three parts. The first one today, it's about talking to the public about controversial topics in science today. This is the second one that will be held on Tuesday, 28th of June. It's about how to write a policy brief. And the third and last one will be held on Tuesday, July 5th, where we're going to talk about how to communicate with journalists. In today's session, we will focus on how to talk to the public about controversial topics in science. And the main objectives of these workshops are to understand the importance of talking about scientific controversies with non-specialist audiences, and also to describe the steps needed when talking about scientific controversies with the no-specialized public. This workshop will run for 2 hours. Teaching will be a combination of a presentation delivered by our speakers and a Q&A. And before we begin, we'll run some important information and housekeeping issues. We'd like to present our speaker today. Again, the session, it's called How to Talk to the Public About Controversial Topics in Science, and will last for an hour. The presentation will last for an hour, and we'll have some time for Q&A after that. And it's my pleasure to introduce Dr. Luisa Massarani. She's a Brazilian science communicator and researcher in science communication, coordinator of the Brazilian Institute of Public Communication of Science and Technology. She's a researcher at the Casa de Oswaldo Cruz, Fiocruz, and coordinator for the Latin America of SciDev.net, the world leading source of reliable and authoritative news, views and analysis about science and technology for global development. She's the author with Catarina Chagas of the book Manual de Sobrevivência para Divulgar Ciência, Saúde, Survival Guide for Communicating Science and Health. And it's a pleasure to have you today, Luisa. I hope that you can easily share your screen and you deliver your presentation. Thanks a lot, and please do not mind in sending any questions or comments through the chat and the Q&A. Thank you. Over to you.
Thank you, Ezequiel. So it's a pleasure to be with you all today. I see that there are almost 200 people from different parts of the world. So it's very exciting to be with you today. And I have a special thank you to the Global Health team for this invitation, and of course also for all the organization involved in this course. Can you see
We can.
Yeah.
We
okay.
Can.
Yeah. So it's a pleasure also to start these three lectures around 3 weeks, and with this very exciting topic, which is communicating science controversies. And sorry, I don't think that's. Oh, okay. Oh, yeah. So the main issue is. Sorry, I can't see yet now it's okay. So maybe to start, why to communicate controversies? I'm sorry, it's not going so well. Oh, okay. So it's not going so well. But anyway, I think that I will manage. Yeah. So I'm highlighting this lesson 6 on reporting on controversies. This was written by an Indian science journalist. I see that there are many Indian in the audience today among you guys. And this was actually a lesson produced in an online course by the World Federation of Science Journalists and us, scidev.net. And it was a while ago, but I like very much this particular lesson because I think that's very update and capture the very important aspects of reporting controversies. So why to communicate controversies? I use this lesson as a starting point, but obviously I add my personal views about the subject. So conflicts or controversies calls the attention of the public, journalists, editors, and communicators. And I highlight the publics, but also some stakeholders like the journalists, editors, and communicators, because it's a very important way to spread the voice about science issues. It can be really exciting, investigative work. Talking about controversies can be really tough, complex. So you really need to be aware of the complexity of several aspects of the issue. So you need to study, to research, and understand more about different sides and aspects of the topic that you are talking about. Controversial issues are a good opportunity to educate the publics and increase public awareness on issues such as climate change and many other topics. And good coverage of controversial scientific issues can benefit the public. So this science journalist, for example, he mentioned that reports of the health hazards of traditional wood stoves for cooking led to an Indian program on smokeless chullas. It's important to highlight that our big dream is to make the difference, right, as a science communicator. And this would be the big dream of really push a government to have a new program. Sometimes that's not that easy. Another big dream for us is change behavior in people, which is not easy sometimes, but still we need to keep our dream and try to make the difference when we communicate science. And another very important aspect of communicating controversies is that actually controversies are part of their own science. If scientists are agreeing in everything, we will not see important developments in science. These are just 2 examples. Dolly the sheep in the late 90s was one of the big stars in terms of coverage, journalist coverage, but also she was people around the world was talking about her very significantly. And I should say that I met her. She was really a pop star. She really liked the journalists. So she was smiling, she coming and like showing herself. And it's a very important issue also if we see behind the scenes, because it was the first mammal cloned. in the world. So the Scottish scientific institution that was responsible for cloning her, they were actually very concerned about how to talk to the public about this scientific discovery or outbreak. And so they were so concerned that she was born, and they waited 6 months preparing the whole communication plan for making the issue public. And they were so careful about that, and then they wrote a press release, a very technical one, trying to take out the emotions about cloning a mammal, and trying to make it really a scientific issue. That the press release was actually a very hard scientific piece of text, and the editor of the BBC, the science editor of BBC, actually read it and thought that it was not that important and put in the bin. And so it's very important also to, when we talk about controversies, to think the way that we are going to make public. And so what constitutes a scientific controversy? Any new point of view that questions current concepts or overturns accepted dogma, theory, or practice is a potential controversy story. And some examples of controversies, when as scientists further our knowledge, they can cast doubts on device and applications based on previous understanding, and this can be a controversial issue. An example, this is an old example, but I think that's very symbolic, is when Nature, the journal Nature, published a paper about how the genetically modified crops, genetically modified cottons, how there was this experiment showing that actually it was causing the death of butterflies that was feeding about the GM corn. And sometimes some publicly funded projects based on flawed science or unsure technology can be really controversial stories. For example, this paper published by Science, in which dumping iron in the ocean to create a sink for carbon dioxide also called the attention of the public. Statement and observation by scientists for report can really be controversial sometimes. For example, the Nobel Prize, James Watson, he was one of the guys that elucidated the structure of DNA decades ago. He was like a part of a landmark in science, and he made this statement that actually he thought that Black people were less intelligent than whites and white people. So it was amazing and controversial, and actually made him to resignate from Cold Spring Harbor Laboratory. Science controversy need not concern on science. This is very important because they usually have a multidimensional approach with ramifications in politics, economic, culture, or religion. For example, again, climate change. And this is a very important issue because I will highlight again and again that this means also that the voice that are trustable or are allowed to talk about the subject are not only scientists. We need to hear and engage other sectors of the society in terms of talking and chat about controversial issues. Also, another, still talking about some example, faking of data, plagiarism, or other forms of misconduct. Science is a whole class of controversy, And this is also a symbolic example when a guy from Korea, a scientist Korean, manipulated the information about the way of researching stem cells. So it was a big scandal too. Public crises such a tsunami or earthquake or air crash or floods, and of course, this is a moment that we can talk a lot about pandemic. They can be really controversial, but also they can channel a lot of controversies, as we saw in the COVID pandemic, as we are going to see with the monkeypox. And this is also an important aspect, because it's a situation that actually we may not want to raise the controversies, but try to calm down the public and see how we can manage the whole crisis. There are also controversies where science is challenged by other approaches, knowledge systems, or ideologies. For example, the discussion about creationism versus evolution. I'm not defending at all creationism. I'm just highlighting one important controversy around an important topic. Big political or economic controversies we see around the world, but that was particularly true in Brazil when the Brazilian government and the president of the Brazilian government start supporting the use of chloroquine, which at the beginning was an important drug to be used in the battle against the coronavirus. But that was fair, because there is this scientific approach of using drugs that are efficient for some diseases. Maybe they can be used for fighting other diseases. And but we saw many papers, scientific papers, showing that actually it was not a good idea in this specific case, and including in many cases it could bring more side effects than actually fighting the virus. Still, the Brazilian government pushed the use of chloroquine and the so-called COVID kit, spending a lot of money and trying to push in different ways in the Brazilian population. Some controversies do not refer to the validity of science, but to the paths of science. So again, I bring Dolly the sheep. You can see that I really like her. And because of that, the whole controversy was not about what the scientists did in terms of technically did. So they could clone a mammal, what was very important at that time and also in the present moment, but it raised the whole discussion about how far science can go, what kind of research scientists can do, what kind of freedom scientists can have or not, and the limitations and the limits of scientific research. And another example also from the 90s was the Genome Project, which of course was and is a very important scientific approach. We have a lot of good things from mapping genes, but also a lot of discussions about, for example, the information, personal information, individual information that can damage the person, for example, in terms of health insurance or other information showing that maybe one person can have a kind of disease and then the employer can not accept this person because she or he has a specific genes, etc. And So again, going back to this Indian science journalist, he prepared this controversy checklist. When preparing a story or a product that can be controversial, he invites you to consider. So he was actually talking more about science journalists, but I included here also if you want to develop a product or a podcast or a drama play or something else about a controversial issue, you can have this checklist. So the first thing is, does your story / product have a controversial angle? So this is a very important starting point, but not the only one. As an aspect that you should have in mind is which controversies are worth pursuing. Sometimes simply it's a bad controversy, something that is creating bad issues in the society. So you need to think ethically and responsible in the kind of controversy that you want to raise. So if you decide to go ahead and develop your product or your story with about these scientific controversies, what are the different perspectives on the controversy and who has rival views? So to identify the stakeholders, the views, and a very important issue is which voices are you going to hear? I mentioned this before, and I want to highlight that scientists are not the only authorized voice to be heard. And this is particularly true when we are talking about science issues that have a very important impact in society. And also are your sources trustable? And how to find trustable sources. So talking again about scientists, of course, we believe in science, we believe in scientists, but not necessarily the scientists who are talking are the best sources. For example, in terms of the pandemic, we saw that many scientists were talking about the pandemic and not necessarily they were the experts in pandemics. So because someone has a doctorate degree, not necessarily he or she is the expert of a different topic. And also, are you distorting the debate? We talk about this in terms of journalists, but it's not only about journalists. When we talk about controversies, sometimes we like so much the controversy that we start distorting the materials, the information for making our point. And this is particularly important in this moment we have the fake news and the infodemic to think in a responsible way how we are managing the information and the words that we are using and the reasoning that we are using. Are you sensationalizing the story? This is very important in journalism, but also in general, and which has to do with the question, are you exaggerating? It's very important to think about that. And so the same controversial issue can be viewed differently by academics, activists, and also by people who are directly involved in the controversies. There is this Japanese movie that I like very much, is the Rashomon, which is the same story that is told following different points of views. And the story is actually totally different according to the point of view. So it's very important when you want to tell your story about a controversy issue, how you develop your narrative and which arguments you use. Which also leads to what I call the balancing act. So in journalism, there is this basic rule that we always need to have a balance of different perspectives of a topic. And but this is a kind of maybe in some moments a kind of naive For example, climate change. There is this understanding in the scientific community that yes, climate change is because it's a result of the actions of human beings. So this is not controversy. But there is a small percentage of people that believe that this is not true. So should we really hear people of different perspective in this particular case of climate change? We think that sometimes not, that we need to understand the whole situation, the whole aspect of the controversy that we are covering, and think how to create this balancing act. And again, I know, I am aware that I mentioned this at least twice, but I'm going to highlight that whom should we believe, whom should we hear, are there interests involved, which ones? So again, when we talk about scientists, we believe in science, we believe in scientists, but sometimes there are other interests involved in the point of view that the person is presented, or sometimes simply that specific person believe in a specific aspect of the controversy. So we really need to contrast the information, to think about the information that you are receiving, and double check it with different sources with different backgrounds. That I mentioned already. So, and another aspect is that, and I'm going back to this aspect at the end when I will talk a bit about vaccines and the controversies about vaccines, is because in many situations, it's believed, especially in the scientific community, that the public, they don't have the expertise for talking about some controversial issues because they are too complex. And I am one of the people who believe that we really need to engage the public, the non-expert people, engage in a conversation about controversial issues. Another aspect of communicating science controversy has to do with ethics. Starting with the situation that sometimes we cover or we talk about some controversy, and then we realize that it was not that true. For example, it's common that some scientists are there are some denouncements of scientists who, for example, are told to be steal some fossils or something like that, and then we actually realize that they are innocent. They didn't steal anything. They didn't do any kind of fraud. And what we see is that when there is this controversial issue of the denouncement, there is a lot of attention, public attention, media attention, but when it's shown that they are innocent, nobody talks more about the subject. So there is really an ethical issue that if happens that you put the light of some accusations that are not true, you also need to talk about the innocence of the people that were accused. Also, there are some situations that actually you have some information and you are not totally sure about it. For example, you hear about a possibility of a nuclear accident or a potential epidemic. So there is this movie, for example, it's a very, I love movies, you are realizing that. So there is this movie that actually there was the expectation that a meteor could reach the Earth, but it was not 100% sure. So you could put the information in the mass media, publicize the information, which means by one side that it would have a panic, By the other side, maybe people could prepare themselves and try to manage better with the situation. And this is something that we really don't know how to manage sometimes. And so what you do? Do you think that we should talk about it, announce about it, that the media should cover it, or maybe not? We have some situations, for example, the H1N1 flu. There was the whole preparation of the world for some massive impact. And actually it was very important. We saw some deaths, and I'm not reducing the importance of that specific outbreak, but the expectation was more than actually what happened. On the other side, with the COVID-19, in some point, we thought that it was something really particular, that we would overpass it very quickly. And in Latin America, for example, we were one of the last regions of the world that the pandemic reached us, and we thought that maybe it will not happen. And it happened, and it was Latin America was one of the regions that we really had a very massive number of deaths. Many of them that could be avoided if we had a proper measures to control the pandemic. And so now I would like to talk about some examples on how to engage the public in science controversies. A suggestion for you guys is that you could in some point do like a mental hands-on activity. We would love to do it today, but we have really a big group, but trying to think about some projects on how to communicate science controversies. So I brought my own examples of some stuff that we did. So for example, this is the worldwide views on biodiversity. And I like very much this example because it was really like an initiative that we engaged many Brazilians, actually 100 Brazilians from different parts of the world. So we invited them to come to Rio de Janeiro to stay with us a couple of days and to talk about biodiversity and how to manage as a society the biodiversity issues, which can be we all believe that biodiversity is important, but how to deal with aspects that impact biodiversity is much more controversial. So this is a line of a participatory activity called Consensus Conference. The Denmark was a very strong country in terms of holding this kind of initiatives. In Brazil, we had only a couple of them. In Latin America in general, I mean, not a couple, but some of them, but few of them. And it's very beautiful because it's a situation that we involve non-expert people to think about something that has a very important impact in society. So we invited them to Rio de Janeiro. We gave them a lot of information. And I mentioned that we are talking about 100 Brazilians, but we choose them in a way that they could be in some way representative of the Brazilian society. So people from different backgrounds, from different parts of Brazil, from different realities, from different perspectives. And so the idea was to bring trustable information about biodiversity and then build with them some strategies of dealing with biodiversity. And the beauty of this project is that actually we took the report that actually was done in different countries, and we presented to policymakers in one of the COPs. The conference that deals with biodiversity. So these are only some examples this kind of activity. But the problem of this initiative is that it's really expensive. So sometimes it's not manageable to do that. But also we did a similar exercise, and in this case was really an exercise with kids between 10 years and 12 years old. So we brought them to our museum in Fiocruz, in Oswaldo Cruz Foundation in Rio de Janeiro. So we did this similar exercise. We gave them trustable information about climate change, and we built with them a letter, what we call it the Carta do Clima, climate letter, which was about the impact of human beings and human beings' actions in the climate change. And we pushed them to think about how their behavior could be changed thinking about climate change. And again, it was a citizenship exercise. We are not sure whether they changed their behavior. We would love to say that they changed their behavior, but it's a kind of exercise that we can push people to think about. And we also succeed in actually inviting some of these kids to go to Brasilia, to our parliament, to meet with some policymakers and to give the policymakers the letter. This is a totally different example of how to deal with, how to communicate with controversial issues. This is a drama play. It was, in English is Bad Blood. And this is a UK, a British a drama guy who wrote it. It's a beautiful and very strong play. This is about the limits or the lack of limits in this particular case of scientists. So it was about a scientist in Africa who was actually in a very anti-ethical way. She was testing a study on infecting people with HIV. And so she inoculates some virus in some women, and to understand more the development of science in this woman. So it is obviously extremely anti-ethical, and it was a whole drama, very well written to talk about that. And then after the play, we used to discuss with kids and people in the museum about the limits, the importance of limits of science and the scientists. This is another project that we hold. I like it very much. It's the name is Sarau Científico in Brazil, and the idea was to engage children and teenagers in science, technology, and health. And Sarau Científico is a kind of science party. It's a party that people go to meet, to dance, sing, read poems, and other cultural expressions, and particularly to chat and share opinions and ideas. So we were in particular concerned about engaging low-income and young people in health research. It was a project supported by the Wellcome Trust, and we developed 5 scripts, let's say like that. One about genetically modified crops, another about stem cells, experiments in animals, genetics, and trials in human beings. And so the idea was to pick up really controversial topics. And so we developed it with a multidisciplinary group, including scientists, experts in bioethics, science communicators, musicians, actors, and also young people. If we want to communicate scientific controversies to young people, we really need to engage the young people in the whole process. So it was very interesting, a lot of music and artistic aspect of the topic, just to show a bit of the image. And then we also, so there was a kind of playful, with a lot of good music and discussions. And then we invited scientists to talk and to chat with the young people. And so every different topic, we invited different scientists, and we really wanted to give the voice to allow the young people to participate and to engage and to have the voice. And it was really interesting project, but we thought maybe we were too cool when we were talking about controversies. Maybe we were a kind of beyond the limits on how cool we were supposed to be in a such important aspect of science. And also another criticism. I mean, we love it, the project, but it's very important to have to criticize ourselves, to have a self-evaluation. And we felt that there was a kind of gap between the artist part and the part of the scientist. So when it was an artist part, it was really cool. And when it was the talk, the chat with the science, it was a serious thing. So how to have a proper balance in these aspects. So I'm almost in the final part of my presentation for opening the floor for you guys, for your questions and comments. But I would like to present some last thoughts about engaging the public in science controversies. These are more about some thoughts that not necessarily are articulated among themselves, but some stuff that I have been thinking about engaging the public in science controversies. So one of the topics that I want to talk about is the event of GM crops in Brazil. So why GM crops in Brazil? I mentioned GM crops a couple of times during this presentation. So especially in the beginning, they were a very controversial issue in Brazil, and it was indeed one of the most discussed issues related to science and technology, both in society, but also in the Brazilian parliament. And another aspect that I like to think about this example is that the scientific community had a very important role in approving the legislation, also in a very controversial way. So it's a controversial topic. The process was really controversial. It generated a lot of conversations about science and technology, and the scientific community had an important role in the construction of the policies for the field. Just very quickly, so since the 90s, we had attempts to produce GM crops on a commercial scale. Then actually in the year of 2000, there was some evidence that actually, although it was not allowed, actually there was the presence of genetically modified products in the Brazilian supermarkets. And 2003 was actually what I call the year of controversies. So it was the moment that the Brazilian government found out that there was a major proposal of the Brazilian soya crops in the south was actually transgenic, illegally transgenic, due to illegal planting in the southern states. And so the previous legislation related to biosafety was from '95, and because of this year of controversy, 2003, the parliament, the Brazilian parliament, started the process for discussing the new biosafety legislation, and it started as talking about GM crops. And then in some point, there was this turning point in which actually it was also about stem cells research. It's important to say that according to the Brazilian constitution, one legislation should be about one topic, not more than one topic. So in this situation, it was about the biosafety legislation, but it was talking about genetically modified crops and stem cell research. And so what we saw was really a movement from the Brazilian scientific community in the parliament for sensitize the policymakers, the parliamentarians to approve this legislation. We can see in this image this is Eduardo Campo, who was the Minister of Science in Brazil at that moment. This lady is a very important researcher, Mariana Zatz, and it's also important to say that she researched some genetically disease, so she deals with a lot of children who will die soon or really have health problems very soon. But what happened is that they took the attention of the genetically modified crop part of the legislation, and they put the whole attention about stem cell research. So they actually took a lot of people in the wheelchair to the parliament during the moments that some decisions were supposed to be taken. And you can see that there is this saying in the t-shirt, which is research is saving lives, and this other one is stem cell is hope. So again, the same situation. Important aspect of this image is that this is a researcher that is actually involved with GM crops, and she was here in this situation talking about stem cell research. And the mass media really supported the whole movement. And this is was the cover of O Globo, which is one of the most important, influent newspapers in Brazil. And that was the image of saying that if you are against this legislation, it's because you are causing damage to the people who are in wheelchair. And so at that time, I discussed it with the science journalist who was responsible of the science section of this newspaper. And she said that it's stem cell we support. We provide good information and good news about stem cells. I'm not saying that stem cell research is not important at all. I really think that's very important to research stem cell. My point is how the whole discussion was manipulated for getting approval of a legislation. And so the legislation was approved, and this was the very first time after all this movement sensitizing of the importance of approving this legislation, because stem cell research could really have an important impact of the lives of many people. Only the day after 24 hours later, the legislation was approved. There was this article published by the Mariana Zatz, by the science, saying that actually the results in stem cell research would take a while to have a really impact in the society. So it's again, it's not that I am against the stem cell research, and the opposite. I really think that we should research stem cell, and it can have a very important impact in the lives of many people. But my point is a situation that was very controversial, and the way that the scientific community, as a community, as the ministry, I forgot to mention that actually she's a member of the Brazilian Academy of Science. So it was science as an institution that was there showing how important it was to approve the legislation. So this is a totally different topic. This is a paper about climate change image. So in terms of climate change, it's very usual that people use dramatical image, for example, the polar bear in a small piece of ice, and a lot of really dramatic presentations showing the disaster, the dramatical scenario that we could face if the climate change really keep changing as it is. And so this paper is very interesting because they analyze the image and they show that fair maybe is not the best way of talking about controversies. So this kind of representation can indeed capture the people's attention to the issue of climate change and drive a general sense of the importance of the issue, but they also likely to distance or disengage individuals from climate change, tending to render them feeling helpless and overwhelmed when they try to comprehend their own relationship with the issue. This is another example that I would like to highlight when actually you may create fake controversies to reduce some aspects of the impact of something in the society. So this is a study about a group this group includes individuals who are denying science, in particular science related to deforestation in Amazon in Brazil, and they try to contest to challenge some important evidence, scientific evidence showing how deforestation can really have impact in the society, in the world. And so they created fake controversies to say that evidence from science were not that strong, and it's also a way of manipulating the situation for trying to reduce the impact of some scientific evidence. As you can see, I'm talking about totally different topics in a kind of chaotic way, just to provoke you guys to think more responsible in the way that you can communicate controversial issues. And finally, my last point that I would like to talk is about vaccines. It's interesting if you think about Brazil again. I'm from Brazil, that's why I give so many examples for my own country. We see that Brazil, but also many countries in Latin America, we had before one of the highest rates of acceptance of vaccination. So Brazil had used to have a very strong program vaccinating people, and we see that because of COVID, sometimes there are much more discussion about vaccinations and controversies about vaccination. I want to highlight this paper that was published by the Lancet in the 90s, and it's an interesting but sad example because it was a paper that tried to show the link between vaccine and autism, and the paper was actually retracted two years later. It was published by a very important journal, The Lancet, but it was retracted 12 years later, and is still an argument of people, a kind of fake evidence that some people use to try to reduce the importance of vaccination, to try to create controversies related to vaccination. And but also I think that the way that we are dealing with the controversies about COVID vaccine should be also be spotlight. So we see very usually that members of the scientific community or people who are medical doctors saying that people are stupid because they reject vaccines, especially COVID vaccines. And but we need to understand further the controversies around the vaccines, the COVID vaccines. So we saw a very rapid development. So we see, for example, dengue fever, which is a very important disease for the developing world for decades. And we are starting to have a couple of vaccines that have been presenting good results, that are starting to be sold, and people are getting vaccines of dengue fever. But in the case of COVID, very quickly we saw not only one vaccine, but actually more than 10 vaccines and 100 of studies of attempts, at least, in developing the vaccines against COVID. And we saw, at least in Brazil, but I think that in many parts of the world, a very important politicization of the whole discussion, starting with China and Russia, but also in the case of Brazil, it was used as a political fighting between the governor of São Paulo and the president of Brazil, and a lot of fake news around vaccine, and but especially this aggressive way that members of the scientific community have been pushing the importance of vaccine. Again, I'm not against vaccine, on the opposite, I'm totally in favor of vaccine. I took all the shots of the COVID vaccine. I'm just highlighting that if we want to engage people in vaccine, we really need to talk to them and to engage them in a proper dialogue, a proper conversation about the controversial issues of vaccine. So this is what I had to share with you and to provoke you, and I'm totally open now for some conversation. Thank you so much.
Well, Luisa, thanks a lot for this. You can take a break after the long presentation. It's been great. Just to summarize before we get more questions, is that Luisa walked us through an introduction of controversial topics in communication science along recent history. Then she shared with us a checklist on some issues that should be considered whenever we are sharing scientific findings to the public. That was very useful. Then she highlighted also the importance of conflict of interest that may arise whenever we're delivering science findings to the public. The important critical point of ethics in order also to be understood and also highlighted. Then she also mentioned some controversies and examples related to biodiversity. Then the example of how, then she provided examples, on how to really deliver the scientific message to the audience, and also to make the audience participate in how that message should be formatted, should be delivered. So she mentioned the case of biodiversity in Brazil, the Saúde scientific also in Brazil, and also this drama play, and also again how to deliver the right message on how to highlight controversies. This was very good. And finally, she shared with us some messages in how to engage the public. And she delivered also the case, shared with us the case of stem cell research and what happened in Brazil, and what of course has lots of controversies, again, of things that should be considered whenever doing that the right way. And finally, the most, I would say, critical scientific message in recent years, which has been all the findings related to COVID. So Luisa had tried to share with us her perspectives on scientific communication, findings communication to the public. We got some questions. We need to understand that this workshop has combining perspectives on delivering this message to the public, which is how to communicate, how to write a policy brief, and also how to talk to the media, which are the three talks of this workshop. And the first one, this one, is how to deliver the message to the public. So some questions are more complex than the message that Laura is delivering to us, but I will try to replicate those questions. And just as an icebreaker, Luisa, I will ask first my questions. One of my questions that I prepare for you is, maybe if you could reflect on understanding that you're not clearly you're not particularly for the healthcare sector yourself, but what healthcare scientific research could have done better? What's your first reaction along recent history, and what are the learning points that we can have in mind for the future? And after that, we're going to the public, to the attendance list of questions. Over to you, Lisa.
Okay, well, as you said, I'm not an expert in this topic, so I have been not following that much the issue. So, and it's a broad questions. I think that what I could say is that really when it's about, which was a kind of the message that I tried to pass here, is that we have issues that have an important impact in society. We need to engage the society in the whole conversation, to really keep a dialogue about these topics. In terms of health, I think that I'm really engaged in the whole discussions about vaccines as not only as a science communicator, but as a researcher in science communication. We have been looking at how the discussions, the conversations about vaccines have been in public sphere. For example, we have a study, actually many studies on how are the discussions about the conversations about vaccines in social networks. And it's very concerning that actually the big discussions are not involving members of the scientific community or science communicators. So most of the discussion are more with politicians or with people who are actually denying science. So that would be a kind of contribution that I could give. That's maybe vaccines are a very important aspect that I could highlight, and how we could engage in a proper dialogue about vaccines in the public sphere. I didn't answer that much your question, I know.
It's a difficult question, but Luisa, you brought great examples from different fields of science that are really very impactful on people. So it's very good. So getting to the questions from the attendees, which are kind of difficult, Luisa. Those are much more difficult. The first one is, defining controversy in science is difficult. How to find out who is right? So that, and and again, just some comments from some reactions from your end.
This is the gold question, right? I mean, it's sometimes if you are dealing with a really important controversy, it's very difficult to find what is right, what is wrong. Depends a lot of many factors. So that's why I think that what we really need to find the controversy, to understand many aspects of the controversies, the different interests involved in that controversy, because sometimes a statement of someone has everything to do with his or her point of view. So again, I'm not answering the question because I don't know the answer. It's quite difficult to know what is right, but I think that our role as a science communicator or scientists who are communicating some aspects of health issues or controversies issue is to understand the complexity of the controversies and try to show the different aspects of it.
Great, thanks, Laura. This question was asked by Manit Kaur. Then we have another question. We don't have the person's name here. Is that this is more specifically to healthcare, because you have pharma companies that produce vaccines, devices, or drugs. Sometimes these companies may announce positive research findings prior to peer review processes. And this may cause overload of unverified information. How we should react to it? Should it be regulated better? And I have a sense that you provided some examples from other fields of science during the presentation. So anything to comment about this?
Yeah, I do actually, especially in the, I mean, we really believe in the importance of having the peer review process of the results. This is a fact. But we also think that's very important, the preprint for giving information that, because the peer review process is a process that takes time. So sometimes it's very time consuming, even if it's a simple paper, maybe it takes like 2 years to be published. And there are some situations that you cannot wait. For example, the COVID situation, in which only in Brazil, almost, I never know how to say numbers in English, is 700,000 Brazilians, almost 700,000 Brazilians lost their lives because of the pandemic. So that was a really example that, and in terms of the world, millions of people lost their lives in the last 2 years because of COVID. So what we saw in terms of the pandemic was that there was a huge amount of preprints that were published. If we look at the websites that publish preprints information, that is a preprint, that is those papers that were not submitted yet, or they didn't finish the process of a peer review process. And so we saw, if we compare the preprint in COVID, dengue, AIDS, or some other disease that have been affecting the society for decades, we saw that the numbers related to COVID preprints is like massive, higher than for other disease. And we do believe that's important, because it was the way that it was, the scientific community was producing very quickly some scientific knowledge to try to see how to put in practice and try to save lives. So saying that it's not important, it would be naive, it would be not paying attention to the whole society, but also it created some results that were not robust enough, and also created a very important aspect of the science information nowadays that existed before, but it was really much more important because of the pandemic, which is the infodemy, which is the huge amount of information, sometimes contrasting information that we really don't know how to deal with and what exactly to believe. So I think that I answered your question in some ways, but trying to summarize preprint information or scientific information that didn't pass through the peer review system, they have an important role, and maybe what we should do is to create more citizens and scientists and doctors, medical doctors, that can read this information, also journalists that can read this information, understanding that it is information that didn't pass through the scientific peer review process. That is to have more critical readers, more critical citizens that can manage information that is not robust enough, that may be not robust enough in terms of science evidence.
Thanks, Laura. Great response. Then we have another question. We have lots of questions, Luisa, sorry. So Doreen, from Doreen Tembo. Again, this is maybe more related to the topic you presented on. It's I wonder if you could share how to engage a wide, not interested audience with controversial topics. Sometimes I find, especially in the global north, that only those who have interest in research or health are the ones who have become engaged. For example, in plays, poems, bazaars, social media campaigns. So it's how we can extend our reach. I believe it's the main question on research findings dissemination.
Yeah, this is an extremely important question. This is an important challenge that we as science communicator we face, because the truth is that especially in the pandemic, I think that science communication has been a very important role in society, including fighting against the pandemic. But what we see is that there is a sector of the society which is very interesting in science issues, as you mentioned. Another sector of the society is not interested at all. And then there is a important part of the society that could be interested if you do something right in a way of attracting the attention. And so I really believe, so there are parts of the society that probably we are not going to reach. And also the fact that people express themselves as interested in science is one thing, which is totally different of actually consuming science information. So there are some surveys in different parts of the world, and this is true also in Brazil and other Latin American countries, that we see that in some case people express their interest in science, but in Brazil it's huge. It's more than football. There are more people expressing interest in science than in football, which is crazy in a country as Brazil, that football has such important role. But when we look further in the information, we see that they express the interest of science, which shows that science is important, but they don't consume information about science. They don't read stories in newspaper. They don't hear podcasts in science. They don't visit science museums or other ways of getting information about science. So I really believe that talking about controversies is an important strategy of engaging those people that are not interested, because controversies in science usually are exactly the kind of topics in science that is not only about science, but a lot of many aspects of science in society. So it's a way of, because first, as it was my very first slide, right? First, people like to be engaged in discussion in different point of view. So there is this emotional aspect of the controversy that's very good to engage people in different topics. And secondly, it's also a way of bringing to science different aspects of society that has to do with the life of people, right? Because in many cases, we think about science communication, and actually we are in our bubble of science. We believe that science is important, and we sometimes we cannot see that maybe it's not that obvious that the aspects of science are important for other sectors. So because of this multi approach of controversy, it could be a good way of engaging other sectors of the society.
Thank you. And related to that question, Evita Chisope asks, where does human autonomy stand in scientific controversy? Suppose someone has communicated scientific controversy and the public opinion does not change. What happens? This is more of an ethical question, but you want to repeat it or it's fine?
Yeah. Could you repeat? Yeah.
Oh, yes. Where does autonomy stand in scientific controversy? Suppose someone has communicated a scientific controversy and the public opinion does not change. What happens?
It happens a lot, actually. Yeah, because I mentioned this in my presentation, but our big dream as science communicator is that we can change society, we can create an impact in society. So there are many examples, for example, climate change, or for example, other or the vaccine aspect. So we really believe that if we start this conversation about science, we could change behavior or something else. But in most of the case, actually, people don't change that quickly. And sometimes they don't change because they don't change, but sometimes because the process is much longer of changing minds. So, and again, I think that I don't want to sound depressive. I really believe in science communication, but it's not that easy that we talk about controversies or that we talk about something science and that the opinion of the people change. It's not that direct impact. And sometimes it's not because they don't like what you say or they don't believe in what you say, simply because changing mind is much more difficult, and particularly changing behavior is much more difficult. So if you go to an exhibition, for example, and you see that how the way that human beings are dealing with the oceans, putting a lot of trash in the ocean, and you can see in this exhibition a very powerful image and immersive situations that show what happens when you put the trash in the ocean, and you get like emotional touch it, you want to change, but then the day after you just forget, because it's the way that human beings sometimes works. So my point is changing behavior, changing opinion is much more difficult than we would like to.
Good, thanks. So Priya Gaur asks, and related to the question again, what would be the fastest approach to convince the public about the falseness and or fake news roaming around? So if there is one. So, and I have and another turnaround to that question is from Joanne Alavson, that asks, what's more important in engaging the public in controversial science? The level of engagement of the public in the discussion or their agreement in the acceptance of science? So first you have, is there a magic bullet to approach this? And then the two alternatives proposed by Joanne, the engagement or the acceptance in science findings.
I think that there are totally different aspects of the discussion, right? One is, so she, right? Joanna, right? So she mentioned first the fake news, and then the acceptance of science, and then the engagement, right? Three components of,
No, first, sorry, maybe I get it. I didn't want to confuse you. First question is there a magic bullet to approach fake news?
Okay. The answer, the quick answer is no.
Yes, I got you. I understand.
So to answer the fake news thing, we believe that if we give the trustable information to people, they will believe that the real information, not the fake news. Obviously, this is again the dream of any science communicator, but in real life, we see that fake news is spread because of much more complex systems. Mechanism. Thank you, Ezequiel. And there are some studies trying to understand why people. There are some studies that show that people believe faster in fake news than in trustable information, and so there are some attempts of trying to understand this. And one of the thinking about that is that sometimes people believe in fake news because it's what they want to think. So it has to do with their mind belief, and that's why it's not a logical thing as we would like that it would be. So communicating science for the people is much more complex than just thinking that if you give the trustable, good information is enough for changing the way that people think. So that was the first question, right? And then there was a second part, which was the acceptance and
versus engagement. What were West?
I think that it's not. I think that we need to think about science communication as a multi-step process in which different aspects has to do. So you can have, for example, projects that raise the discussion, the controversies about an issue, which has a very important aspect of engaging people in the discussion. And you can have other ways of dealing in which to give evidence, trying to show, I prefer to not use the word acceptance, but I will prefer to use trust in science. And because I don't think that we need to accept science. We need we need people to trust in science because science is trustable. When we talk about acceptance, and I'm sorry that I'm talking about specific words, but as acceptance seems to be something that we need to accept, and that is, it's like we need to brush the teeth 3 times per day, and we need to accept that. When we talk about science, we really need to motivate people to trust in science and to trust in scientists, but not in a blind way, because scientists sometimes are not right, or sometimes there are good things of science that is not exactly what society wants in some point, or we need to understand the complexity of the issue. For example, the way of producing energy. We have nuclear power, we have the dams, the electrical, that some parts of the forest need to be devastated to create the dam. So we can make a point that in many situations, we don't have the ideal way of dealing with a situation, for example, generating energy, but we need to think about the different possibilities and think what are the side effects of one possibility and the other, and try to think which could be the best in a specific situation. So, for example, we can think that wind could be a great strategy, a great tool for generating energy, but then you go to a place that there is no wind at all. So we cannot use that kind of strategy. So it's trying to balance the different options and try to understand the different side effects and what people think about that too.
Great, thank you. So, I have a question from Wase Benti Ahailu, and anything you'd like to add to what experience or models tailors engagement to arriving common sense ground amidst of controversies? Do you think anything else to give it like a final message and how to better engage the audience into science delivery?
Yeah, I don't think that there is a magic way of engaging people. I really believe that we need to have different actions with very diverse ways of engaging people in order to engage them. So, for example, I think that museums are great for engaging people. So they go there, you can do a lot of different hands-on activities, but you are engaging only the people, a small number of people that can go there. So it's very good because you see the eyes of the people, you see if they are actually reacting or engaging with your activity. If you have something, the TV news program, for example, you can have impact in a huge amount of people in a different way. So, and if you do a podcast or a YouTube or a WhatsApp group, so you can see that you can reach and engage people in different ways using different tools. So my suggestion for you guys is try to do different strategies, different initiatives, trying to engage the public, involving different parts of the public, different sectors of the society. If you are creating an initiative for thinking about young people, is one kind of approach. If you want to deal with old ladies or senior people in a community, you need to engage in a different way. If you want to engage kids in science, which is very important because they will be the future citizens, right? But it's a totally different way of engaging them. So you are not going to talk to some stuff to the kids, or at least not in the same way as you will discuss with senior people, for example. So my message here is, don't try to find one single gold solution for engaging the public. You can do that because you like more to engage in a way or another. But as a institution or as a society, let's engage people in a very different ways, using different strategies and tools.
Good. Now I will embed a question from on my own, just to rephrase the ones that are still pending. If you would be advising a research institute, what would be your advice on how to establish a team of communicators in the research institute to communicate big audiences about research findings? Because I believe that most of us work in research in many stages of life still, and I'm sure that some of us do better than others. So what are the critical advices whenever we are just trying to make sure that we are getting the right people into place whenever delivering messages to big audiences?
Yeah, we obviously depends a lot of how money you have, for example. How sometimes it's not only about money, it's about how the bureaucracy of your institution allows to attract human resources. So but the ideal thing, if you have the structure, the money, the possibility, would be to have a group of people with different expertise and different backgrounds. I'm talking about because communicate via social media is one kind of expertise. Communicate via video or is a different kind of expertise. Communicating face-to-face activities is a different kind of strategies, but also people from communication, people from with a scientific background, people with artist background. So if you can do a group of people, try to engage people with different point of views, different backgrounds, and different expertise, which will help a lot. And also to engage the scientists of the institution in the process. Some scientists sometimes feel that they don't have time, that they are too busy, but they can be engaged in different ways. Some of the scientists like to do themselves some communication actions. Others don't like, don't feel they are shy, or they don't feel that they can communicate well. But my advice would be try to help in a way of another. So for example, if you are a shy scientist that you don't like that much to talk to other human beings, but if there is someone in the public engagement sector of your institution that she or he needs you for some specific task, put yourself in that task, because it makes a lot of difference.
Perfect. Well, thanks a lot for that. Two last questions, Luisa, okay? So you can take a break. So Ramon de Paciencia shared with us a very interesting comment. She's from everything you have said, it seems that engagement needs to be sustained and undertaken, especially amongst all sectors of communities and age groups. At times when the topic is not yet a crisis, as well as regionally relevant. but there seems to be so much funding when something is a crisis. Any pointers for us wanting to engage on how to avoid bandwagon or topical engagement, but rather how to do it sustainably? You got that? It's not to...
kind of, it's about how to make engagement sustainable. Is that correct?
Yes, but not during crisis, but to do it without a crisis to happen, but before that.
Yeah, a very important issue is to consider public engagement in science or in health as an important aspect of the society in general and of the scientific institution. So when I start working, my background is in journalism, in communication, but then I did my master in science information, my doctorate in biochemistry, my postdoc in education, and then another postdoc in science and technology studies. And but my point here is that when I start working in, I always have been working in science communication as a science journalist or a science communicator or a researcher in science communicator. And when I started 30 years ago, we didn't see that much support for science communication. I'm not saying that it's enough, but what I'm saying is that it changed a lot, and I think that increasingly it's being understood that science communication or public engagement in science is a very important aspect that should be supported. So we see nowadays, for example, that there are much more scientific institutions that have a team for working public engagement. We see, again, I'm referring to the Brazilian case because I know the best, but we see, for example, we had in some point a very important science a policy for science communication, which made all the difference. I'm talking about money for science communication. I'm talking about opportunities for science communicate to have a job in science communication. And I'm also talking about respect and visibility of the work of science communication. So the whole structure in the Ministry of Science, for example, was destroyed, which is very sad. But we see that still there are some positive aspects of it. For example, if you go to the CV platform that we have in Brazil, the Plataforma Lattes, which joins all the CVs of people who want in some way work in science or they work in some way in science, you see that there is a part of it that is about science popularization. So you see that there in some way, even if they are not supporting that much science communication in the present moment, in some way there are some much more visibility for science communication. The CNPq, which is the Brazilian Science Council, which support a significant part of science and technology, they do have now a committee for science communication. So they have a committee for biochemistry, for physicists, for different scientific fields. And they also have this committee in an equivalent way for science communication, which means that people who want to do research in science communication then can apply to experts in science communication and be supported for doing some research in science communication, which includes public opinion towards science, public perception of science and technology. When I say science and technology and health issues, how the science and issues and science and health issues are permeating the public sphere. So different kinds of research in science communication. So basically, I think it's a process that we need to persuade the policymakers, the institutions, the society that science communication is important. We need to give a job for science communicator. We need to engage scientists in science communication, and we need to, in some way, create strategies for keeping this in a sustainable way. So I mentioned the policy for Brazil. We had also in Argentina, in Mexico. So in some way in Latin America, we have been shaping in a way that we are creating more room for science communication. Colombia, they just launched a very important group of documents talking about what they call, in a very interesting way, science appropriation, which is really how society engage with science and health in a very in a kind of citizen way. So basically it's that. I think that we need to create an atmosphere, a culture of science communication around the globe.
Thanks, Luisa. Last question. And, for all the people that make questions during the Q&A, I try to either maybe move away from the ones that were too specific, for some health topics that maybe Luisa cannot cover. And also some of them were already answered in a previous questions that were already made or during the presentation. But I believe that the last one is kind of maybe interesting, and just to summarize, and it's made by Kefli Johannes. And how do you assess the impact of your engagement project, their understanding, behavioral change? Was it qualitative? Because for all of us that work in research somehow, we want to change the way healthcare is provided or any field that we're working in. And we may find some ways to do that. But from your perspective, whenever you're trying to deliver the right message to the public, how would you measure that that's happening? Understanding that we're always talking about certain particular regions of a country or province or either municipalities. It's impossible to measure worldwide, at least from our perspective. Over to you, Luisa.
Yeah, it's a extremely important question. By the way, it's amazing how very good and important questions were raised here. Many of them are actually the golden questions that we have been facing in science communication. And I think that the impact is really the question mark that we need to deal with. Many countries or institutions, they are starting to be more sensible to science communication, but there are a few efforts in trying to understand the real impact of science communication, and not only the impact, but in a more like a long-term process of understanding how science communication can change behavior or opinions and etc. So we have been doing the way of doing it is it's not there is not a simple way of doing that. There are different strategies of measuring the impact of science communication. One of the ways that we have been doing in terms of, we do a lot of work in science museums, right? And science exhibitions. So a very strong area of research that we have in our institute, the National Institute of Public Communication of Science Technology, one of the research areas is to understand what are the experience of people have in a science museum visit. So basically what we do is to put a camera, a GoPro camera, that one that people bike or surf or skate. So we put that in groups of people. It can be teenagers, it can be families, it can be kids. So we put that camera, so we record the whole visit, and we try to understand we analyze the conversations that the whole visit raised in people. So it's very interesting because we can see that in many situations, a lot of science conversations are raised because of the exhibitions, because of the museum visit. So this is one way of understanding the impact of that exhibition, how people are dealing with the information. This is one way. Another way, for example, is to try to look at the impact of the visit of a museum sometime later. So, for example, we have a study trying to understand the impact that people had visiting a beautiful science museum in Piauí, in the north of Brazil. And it's an area very beautiful, very cool area in which there are a lot of, I don't know how to say in English, in Portuguese is rupestre, is the old human being.
Yes, rock painting.
Yeah, in rock painting. Yeah, thank you. Yeah, so it's a region of Brazil that there are a lot of beautiful rock paintings, and it's very important for collecting evidence of when the human beings arrived to America. And so they built a new kind of new science museum there, and we have information of the visit 2 years ago, and then now we collect the information of two years later. So what kind of memories of what kind of what people think about this visit 2 years later? What kind of impressions stayed in their memories? And this is very important because the memories are have everything to do with your the learning process, right? The emotions, the information, everything that you get from for example, from visiting a museum has to do with this your attitudes, your opinions, and your the way that you build knowledge. So these are two kind of examples that we can have. Then we can have we also have other kind of studies trying to understand, for example, how people deal with some information, science information, after some situations. Another study is how people look for some specific situations. So we have a project trying to understand how young people look information about vaccine, about Amazon. So we record their searching in a computer, and we talk to them trying to understand the reasoning, the process that they try to look for information in science, but also how they, for example, they check whether the information is trustable, whether the source is trustable, whether it's fake news or not. So there are different ways of thinking about the impact of science communication. It's not easy.
Perfect. Well, Luisa, thanks so much. You did very well. It's a most of the people that attended remain for the whole 2 hours. So you did great. Thanks a lot. It's just as a final message, I like again to thank the Global Network for inviting IECS, the place where I work in, to chair this session. It's been great to hopefully be part of this network for the future. Thanks again, Luisa, for all your presentation today. Again, I understand that people has your email. Hopefully you can answer any questions that they may have over email in the future. So thank you again for your participation, this first part of the workshop series, and thank you to you and our panel today. Again, remember that this is the first part of free. For you to get the certificate, you get to go through the 80% of these free sessions. The recording of sessions along with additional materials will be shared. The link to where you will be able to find them will be posted in the chat now. Hopefully it's there too. Remember that, again, as I said, to be eligible for certificate of attendance, you need to cover 80% of the free sessions. And we look forward to seeing you in the next session in the workshop series on the June 28th, where the topic will be how to write a policy brief. Please use the same link to connect. So thanks again to you, Luisa, for being with us today, and for the team of the Global Network to organize this. And it's a pleasure to share this morning afternoon or evening with you all. Thank you.
Thank you all. It was really a pleasure to be with you all today. So thank you so much for allowing me to be here with you guys.
Thank you.